Good evening, sir.
Yeah, good evening.
How are you doing today?
Very fine, thank you.
Okay, please, sir, can you introduce yourself?
My name is Dr. Awunor Alexander Chidubem. I'm the convener of the Anoma Medical Professionals Forum.
Okay, so how has it been so far?
Well, as you can see, the program has been awesome. Um, we started yesterday, which was the day one, and we saw a large number of patients. We had three surgeries. Today, we continued. We had an impressive number as well, and we even had an impressive number of surgeries as well done. And the program continues till tomorrow. So, in a simple word, I would say the program has been impactful and has actually lived up to the expectation.
Okay, so what were some, or rather, what are some of the treatments?
Our basic comprehensive health checkup, we had a health talk where we discussed on some common ailments, diabetes, hypertension, dietary counseling on what patients should eat and how they should live, even when we're not here. Their routine examination, pressure check, blood sugar assay, malaria and hepatitis screening, all done here. We went ahead to, have our physiotherapy section where we'll give them normal homemade physiotherapy exercise they can do and how best to seek for the care when we're not here too. We have the eye section, eye screening and dispensing of lenses. We have drugs being dispensed at no cost to patients. Then we also have surgeries here. We had some surgeries at hydroselectomy yesterday, excision biopsy. We had a herniorrhaphy, two of them today. In fact, as I speak, we've been in the theater since morning. We just came out now, and the last patient is on the table being operated on. So, by and large, the program has been very successful, and I think this is one of the best that we've done in this axis of the local government.
Wow, that's very, very impressive. So far, has there been any challenges encountered?
Yes, actually, the challenges we had yesterday was because of some local village engagement that the community had. It actually prevented them from coming in, but they were able to surpass that, and most of them came out in their numbers today. Also, challenges we had with the health center that we're using for this program had some logistic issues, so we had to fix them all up before the program commenced and the rest of them. So those are normal things. This is a rural community, so we expect to have some challenging hitches. But to God be the glory that we're able to surpass and surmount those challenges, and the program has gone on smoothly.
Okay, it's a beautiful thing that the program has gone on smoothly. So, are there any people you want to give like special gratitude to or appreciation to?
Of course, the first of them on my list are the AMPF team, because they've been amazing. You see their faces when they give back to the society. These people they're not being paid for their services. They don't pay them. They don't pay them. They just give out their time, their talent, and their resource towards service to humanity. Nobody pays them. So you see the joy in their face, you see the happy family, you see how happy they are helping people. I want to say that without them, this program wouldn't have been possible. But my special appreciation goes to them. As we keep it up for the resilience that they we've traveled far and wide for many medical activities, and without them, we can't be here. I especially appreciate them and I thank them for all their efforts. And also to the Omiwa Foundation, I know you must have interviewed the president who came all the way from the United States just because of this program. And he happens to be an indigene of this particular town. So maybe that explains the reasons why he came down for the program. And also his vice president, Mr. Felix Okafor. Another board of trustees, Dr. Nwoye, Chief Amagu from Ezi, who personally came down from Ezi community just to give us some words of encouragement and appreciate us for all the kind gestures. I appreciate too many people, and also not forgetting the young health assistant at this health center, Mrs. Awele. She has been awesome. She has been helpful. She has been helping us with everything we needed here, cleaning, arranging, every possible things, every possible thing to do. She has always been there. I want to especially appreciate her, because she is actually someone that we would want to work with anytime. That selfless heart, that heart that is doing things without even expecting anything in return. That is what we are looking for. That is what we want, and that is what we cherish. So I want to thank her, and also to many other people, too numerous to mention. I want to thank everyone who made an impact, positive impact in every little way. So I thank you all.
So, do you have any words of advice to people who may be planning, or persons who may be planning such outreaches as these in their communities?
Of course, we can't do it all. We encourage everybody to do plays our own parts. I believe in community effort, because that's why most of our outreaches we do that at the primary health center. We need the community effort. The communities who intend to do this will have to sort out their own issues first. Then they will now call on us. We would say what we can do. But we believe in community effort. Just give and take. You bring, we also bring. So we synergize. That's what we're preaching. So health is wealth. I've always said this. If you are not healthy, it's as if is not the life you live in lacks quality, because health itself is the life. If you're not healthy, you're not alive. So it's supposed to be the priority. My own advice is that these are health centers, primary health centers, they are underdeveloped, especially in some in this health center, underdeveloped, because I'm not a politician, and I don't talk for or talk against anybody. I speak based on what I see. I speak based on what I see. What we see in health center that we go to is nothing to write home about. All relevant government agencies should, as a matter of urgency, take care and put these places in the right order, because these are the places that are closest to our people. This is the health center in the midst of community. You can just check out the communities there. At any point of call or any issue with them, they run down here to take it. So if this place is not in order, where do they go to? That's why I'm kind of encouraging them to go into the hands of people who are not even qualified to take care of them. That is what you are telling them indirectly. This place was a mess when we came in. We had to arrange. I said people have not. And it just gave us that a clear picture that people have not been coming here, and people they can't come here because the place was not in a good state. I appeal that they should do something very, very urgent about it. Idumogo, Ukwu, these are places that we are visiting, and there are places that health centers are not going to write about.
Thank you very much, Dr. Awunor. Thank you very much. All right, we've been speaking with the founder and convener of Anyoma Medical Professionals Forum, Dr. Alexander Chidubem Awunor, and he has said it all. He has encouraged that everyone in the society should contribute their quota in seeing that the healthcare system in the society is not abandoned.